Gynecologists, what's the worst thing you've ever seen? Enjoy your meal. Gynecologist in touch. Sometimes I come across unpleasant cases when a girl walks with one tampon for days and weeks. Necrotic cancer of the vagina also looks so-so. But this is not even close to the worst case in my life. Once a 19-year-old girl came to our clinic and complained that her vagina was stuck with a hairspray cap. Well, it's not a problem, I thought naively, but the catch was that she put it in there at the age of 15, that is, 4 years ago. She didn't explain the motivation for this action to us, but it was clear that she was very ashamed. Even before she undressed, you could feel just a terrible smell, which became even worse when I went to study the problem. The cap was stuck with the edge up, and it was clear that in 4 years she had grown well with vaginal tissues. The difficulty of the treatment was exacerbated by the fact that this cap pierced her bladder and rectum. To get it out, she had to do several surgeries. I'm not a gynecologist, but I know someone who recently had a hysterectomy, an amputation of the uterus. In general, the girl had stitches in the vagina that needed to be given to heal, but she was so impatient to return to sexual life that she couldn't stand it and broke down. As a result, a thin intestine fell out of her vagina. I was told everything in such detail that I think I will never be able to eat minced meat again. According to the girl herself, when she went for an emergency surgery, she felt her intestines lying on her leg and pulsating. How to delete someone else's comment here? I had a friend in high school who was very afraid to go to a gynecologist. When she finally decided to go for her first stroke, she was so nervous that she clamped the doctor's feet like in a vice. According to her, some time had passed before she was able to relax and release the doctor. It was extremely awkward. Now, of course, she is laughing at this situation, but her fragility in relation to her female organs has not gone anywhere. She doesn't even like to use tampons. I am a student of the medical university. Once I signed up to be an assistant for the amputation of the uterus. When we went for the surgery, we were told that there was a small cancer of the ovaries, but it turned out that everything was much worse. All the insides of the patient were in the metastases, so we spent 13 hours on only one reduction of their volumes. Although the whole operation was supposed to take 3 hours. At some stages, the guys from general and vascular surgery helped us. We replaced half of the patient's blood volume. After all the experience, she was very unwell. She had a long and difficult post-operative period, but in the end, she somehow moved away and returned home to her family. For all of us, it was a very exhausting case, but the patient and her family turned out to be just wonderful people. So it was an honor for us to help them. I'm not a gynecologist, but sometimes I do examinations. Once I took out a tampon that had been inside for at least a month. What's most interesting, the girl had sex all this time. The smell was just hellish. When she left, it took a few more hours to ventilate the room. All this time we were leaning against the clinic and thinking how not to vomit. My dad told me about a woman who had a severe addiction to heroin. For some incomprehensible reason, one day she decided to show her creativity and stabbed herself in the genitals, which led to gangrene. I think the game wasn't worth the candle. I was a little late with the answer, but still. I'm a medical student. In a few weeks I'll be a full-fledged doctor, though not quite a gynecologist. When I had practice in gynecology, I was sent to examine a young lady. While I was preparing for the examination, the smell in the room was so strong that I started to think that the most terrible bacterial eugenosis I've ever seen was waiting for me. I climb inside, start to study everything, but I don't see any unusual detachments. Strange. I start to move back, and I feel that the further I move, the stronger the smell. It turned out that her legs just smelled wildly. I highly recommend everyone to read the book by Dr. Lisa Rankin, What's Up Down There. There is a section in which she writes about the worst cases in her entire career, for example, how she found larvae, money, and so on, but that's just the beginning. The coolest case was about a woman whose vagina grew potatoes. Check it out. Wait, what? In short, as a countermeasure, the woman decided to put potatoes in her vagina. And since potatoes love warm, dark, and humid spaces, he began to grow actively, and as a result, the potatoes grew out of her vagina. My sister is not about a vagina, but about boobs. But it's no less disgusting. When I was in high school, I joined a student organization that sent students to practice. I decided to go help at the trauma center. Once, a very full woman was brought to us. Complaints, chest pain. Everyone feels that a terrible smell comes out of her, so the doctor decides that she should be washed and examined. He washes her, lifts one of her breasts, and from there such a stench begins to come out that we all almost lost consciousness. There was a colourless portia under the breast. The doctor washes her, a crust comes off of her, and a small hole is exposed from which cockroaches begin to come out. Most likely she had eggs laid out in the fold under her breast, and when they hatched, the cockroaches could not find a way out, so they had to gnaw their way to salvation. My mum had a story that seems to me to be the most disgusting of all the hospital stories I've ever heard. Once, a 50-year-old patient turned to them. Very fat, 227 kilograms. She comes in and says that her husband, during love affairs, complained about some strange smell. But the joke is that this smell was felt not only by her husband, but by the whole hospital. In short, I don't remember all the details, but in the end, it turned out that all her vagina was in the necrosis. A surgical intervention was needed, but it did not save her. Soon she died. The best part of this story is that her husband felt this hellish smell first, and during sex. I'm not a gynecologist, but I've also seen a lot. First, I saw a woman with a vaginal cancer. Then I saw what happened to her after the complete removal of the vagina and uterus. The spectacle is not very good. I can't describe to you exactly all the procedures done because I was a very young student then. But in the end, only a large hollow remained from the former organs, from which something was dripping. The poor woman was so killed by grief that she begged her husband to leave her because I quote, "After that, you will never be able to love me." But he turned out to be a good fellow. All the time he was near her bed, held her by the hand, calmed her down, and nourished her with love. It was clear that the dude just adores her. Second, a 220-kilogram lady came to us with a paralysis of the lower limbs. She had a giant ulcer and a necrotic facet, which destroyed everything that was in the genitals and buttocks. There was erosion in the rectum. We realized this because fecals flowed out of several areas of the damaged surface. When the doctors asked us to take urine from her, it turned out that she no longer had a urine bubble as such, and neither did the vagina. It was decided to try to patch up the wound somehow. The 6 of us somehow turned her over and, in fact, began to shove a bunch of gauze into a giant hole, hoping that she would not shit during the procedure. She died very quickly. In such cases, we are helpless. I feel so sorry for the first girl. I hope she is happy now. I feel sorry for all the people in this thread, including the readers. I'm not a gynecologist, but since I was born, there was one defect that I didn't pay attention to until I started using tampons. The point is that I had a partition, because of which I had not one hole, but 2. And I realized that I had a problem only when I once unsuccessfully tried to pull out a tampon from myself. I put it inside through one hole and then tried to get it out through another smaller one. Here it is stuck there. It hurt like hell, but I couldn't do anything about it. Fortunately, this happened when my mother was nearby. She thought I was just an idiot who couldn't get a tampon, but then she saw what was going on and took me to gynecology. I had an operation, and now I have no problems. I'm not a gynecologist, but while I was working in a trauma center, I also saw one interesting case. An elderly woman was brought in after a fall. We begin to look. She has a giant cancer of the vagina. Her pelvis looked as if 2/3 of a football were stuck to it. The tumor was so big that it pressed on the nerves of the left leg and obstructed the blood flow, which is why she fell. Do you know what happened to her later? No, when I left, they were still working on her. I hope that in the end she was sent to the hospice. Just with such a tumour, at the age of 80, there is no point in doing chemistry, radiation, or surgery. I work as a nurse in the gynecological department. Oddly enough, I encounter all sorts of horror quite rarely. Our women are quite sensitive to their vaginas, and in general, the vagina is a very durable organ. It can withstand even the most wrong treatment. The worst case was when a woman came to us for a hysterectomy. At the beginning of the operation, the surgeon made a mistake and accidentally cut her gut. It was decided to interrupt the operation until the gut healed. But everything went wrong, and she didn't heal. In general, soon the cut in the gut fell off from the post-op wound on the stomach. There was no swelling, through which the exercises came out, and the wound through which the feces come out is not so easy to heal, you know? As a result, the woman stuck in the hospital for 9 months, survived 1 million infections, ruptures of the wound, complex bandages that lasted for hours, and so on. At one point, her fecal wound was so healthy that 2 of my fists would easily fit in there. It all ended with her having a permanent colostomy, a bag for poop. And according to the latest data, the uterus was never removed. Well, thanks to your stories, I will never be ashamed that I didn't shave my legs or bikini zone before going to the gynecologist. A couple of years ago, my colleague was an intern at the gynecology. Once a young patient came to him with 2 complaints. First, she can't get pregnant. Second, she has a permanent diarrhea. The gynecologist asks, "How often do you have sex through the anus?" She answers, "Always." It turned out that her boyfriend convinced her that it is easier to get pregnant through the arse than through the front. So she asked him to fry her only from behind. The story of my colleague gynecologist. The girl came to be examined, climbed into the chair, and my colleague put her fingers on her mother's neck. At this moment, a brilliant question comes to her mind. "Have you ever thought that this is something like stuffing a turkey?" My colleague, trying to keep a stone face. "No, but now I will think about it every Thanksgiving Day." The patient started laughing, then looked my boyfriend right in the eye and clapped like she was a turkey while my boyfriend's fingers were still in her. My favourite story for Thanksgiving Day. My grandmother worked as a nurse in the gynecological department for 20 years. One time she flew in, angry, home and yelled, "If I ever have to look at someone's vagina again, then I will definitely hit someone." Parallel, breaking all the dishes in the house. The next day she quit. My mum works as a gynecologist's assistant, so I've heard a lot of different stories. One day, a woman came to their office who rumbled like garbage. It turned out that she wore the same panties for 2 months. They were dark yellow-brown. Apparently, no one told her that her arse should be wiped. I had a very strange first trip to the gynecologist. I was very nervous, and I came across some old woman who clearly noticed it. To somehow lighten the mood, she says to me, "Well, you're lucky you didn't get to the gynecologist, man. They don't have fingers but healthy sardines." Then she put her shaggy grandma's fingers in me. Thank you very much for watching. In the comments under the video, gynecologists can write what was the worst thing you've ever seen. And don't forget to watch our other videos. And yes, by the way, bon appetit. Bye.